Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I'm joined by PJ Rescigno with Planned Administrators. PJ, thanks for being on.
Oh, my pleasure. Thank you for having me.
Absolutely. Well, let's start by introducing the audience to Planned Administrators, or PAI. Can you talk about what markets you serve and what your focuses are?
Sure. So PAI is a wholly owned subsidiary of Blue Cross Blue Shield of South Carolina. We're based in Columbia, South Carolina. We are a good-sized TPA. We've got about 400 employees, and we really have three main markets. Our first market is what we refer to as our traditional major med business. That is predominantly in South Carolina, but we are aggressively growing outside of South Carolina. We also provide a service or a line of business through what we call our specialty administration, which is what I have responsibility for. And we provide a host of backroom administration for carriers, different lines of businesses. And our third line of business is our property and casualty business, which is our newest market, but we're very excited about that as well.
Yes. You mentioned where you're geographically located, but talk a little bit about the target audience and anything that relates to limited benefits or ACA compliance plans. I know you all are very active in that space.
Yeah, we're based in Columbia, South Carolina, which is great, but we do on our limited benefit and ACA compliant plans on our specialty side, as well as our carrier administration, we don't do hardly any business in South Carolina. We are a licensed TPA in all 50 states. We do business in all 50 states. And so it's really an exciting opportunity. While we're based in South Carolina, we do little to no business in South Carolina, and the rest of it is all over the country.
Can you define limited benefits for our audience and then talk a little bit about who generally offers those plans?
So limited benefits by its definition is just that, a limited benefit. So it's what we refer to as a hospital indemnity or an indemnity type of a product, which means you have a service done and you get a flat reimbursement for it. So if you go to the doctor, you get a flat $100 reimbursement, regardless of what the charge is. It's a payable. That's just a flat dollar amount. And who generally are offered our products are part-time and hourly contingent workforce. So if you think about staffing business, hospitality business, just different, more high turnover people that generally don't have access to group sponsored major med insurance plans. That's who predominantly takes our, what we call limited benefit offerings.
Got it. Seasonal workers too, I'm sure.
Seasonal work in it. Yep, exactly.
So how do those plans compare in cost to a comprehensive health plan?
Yeah, so they're obviously significantly cheaper, but they also, and it's very important for us to make sure everybody understands, both at a onboarding or an offer perspective, they're not major med comprehensive plans. They're priced accordingly, but they also provide benefits accordingly. So they're significantly more affordable than your comprehensive major med plan, but they also have some caps on what they cover and what they don't cover.
Can we talk about what those would be, what the coverage details are?
Yeah. So preventative and wellness, the essential care benefits, they're offered because they have to be offered. So those are your 67 preventative and wellness coverage on what we have a MEC plan, which is a minimum essential coverage plan. That's what they cover all of those 67 preventative and wellness benefits. The other limited benefit offering is they'll cover doctor's office visits, x-rays, diagnostics. They'll cover some inpatient benefits, but they'll have caps on them. They'll be clearly defined. We never want anybody purchasing our product if they don't fully understand it, because that doesn't end for a good experience for them or us. But they meet a niche for a niche market. They do supplement when some of these employees will have major med plans, but they have very high deductibles. And so these plans will allow to cover some first dollar coverage before this employees meet their deductibles.
Okay. And just thinking about the nature of the employer base you're serving, it sounds kind of like it's almost like a plan in a box, but is it customizable at all? Or do employers and employees get any type of options with it?
Again, good question. Yes, short answer is yes. Longer answer is a little bit. We generally have 4 plan designs that we've created and offered to the different industries that we serve. We don't do that because we don't want to customize plans. We have learned, we've been in this business since 2004. We've served millions and millions of clients. We've done it for a long time. We've understood it. And what we've found is if you give people too many options, they get confused on the benefits. So generally, we will encourage our groups to offer 1 or 2 plans to their employees, and they are the same plans with varying reimbursement amounts. And obviously, the higher reimbursement, the higher the cost. So we have a very affordable low-level plan all the way up to a richer plan, but it costs the employee more money.
But that's great that within that framework, you're offering a variety of options. Do you have any success stories you can share, or can you talk through what the appetite is for the employers you're serving?
Yeah, a couple success stories. So we did a study about 5 years ago, and what we did is we took our block of business, so our millions of members that are enrolled in our plan. And keep in mind, these are part-time and hourly, high turnover. They'll come on assignment for a week, they'll be off for a week, they'll come back on for a week. And we get challenged by our groups a lot of times is, what's in it for me? How does this help me retain or recruit new employees, especially in a tight market, right? So we did a study based on how long people stay on our plans and therefore stay with their employer if they took our benefits compared to if they don't. And we saw a 50% increase in how long they will stay with their employers for the ones that were enrolled in our plan. So they see value in our plans because these are group health plans. Once they leave the group, they are no longer able to take our plans. We don't offer individual plans. So that was a great success story because it allowed, especially in extremely tight labor markets, it allows our employer groups to differentiate by offering a benefit that their employees are obviously looking for.
Sure. And not to mention, even though you're serving a market that is used to high turnover, there is a dollar price associated with each employee that turns over. And so you're not only impacting the longevity of the health of the employee, but also the bottom line of the employer by keeping that employee in place a little bit longer, which is tremendous.
Exactly. If you think about it, take it a step further, our biggest block of business is the temporary staffing industry. So when a staffing company onboards an employee, they are trying to find them a placement of a job, right? So they will place them at a location, and that's how they make their money. They get paid to place jobs. So if those employees stay with them, stay with their placement, that helps them improve their revenue stream. That's been probably our biggest success story that we've realized over the years.
Okay, can we jump back into the nuts and bolts of the plan a little bit?
I love the nuts and bolts.
I want to talk about the network and accessibility. What does an employee have access to?
Sure. We have a network that is for all of our employees, both on the medical side. We use the First Health Network, which is a network that is not going to be from a discount perspective like a Major Med, a Blue Cross or a United or a Cigna network. But that's okay because these employees are looking more for coverage than they are discounts. And so it's a network that's generally got about 99% coverage across the U.S., which means that 99 out of 100 of our employees, if they try to go to a doctor, they will be able to find an in-network doctor, which will allow them, again, it doesn't benefit us because we're paying a flat dollar amount when they go to the doctor, but that allows the employee to have their dollars go even further. If they're using an in-network provider, their charges are going to be less than that. And so what we're able to do is we're able to leverage our millions of members to go to the networks and allow us to get these members access to that network that they wouldn't have had on their own.
Okay, so PJ, you've mentioned the employee. Is it limited to employees only, or does it extend beyond that?
No, we offer 3 or 4 coverage levels or tiers, which is employee plus one, which is generally a spouse. We also offer a child, employee plus child or children, and then we offer a full coverage level. So no different than your comprehensive medical offers as far as who they can offer it to.
And speaking of comprehensive medical solutions, oftentimes in the benefits arena, you hear about wellness programs. Does PAI bring access to wellness programs as well?
Yeah, in these benefits, they have preventative and wellness that are included in their benefit offering. It's generally tied into the package of benefits that the employee purchases.
I'm going to shift gears from what's offered to how it's processed, because claims processing can be overwhelming, confusing. And so can you talk about the claims process for the members that are enrolled in these benefits plans? And does PAI do anything to ensure a smooth process?
Yeah, so we really pride ourselves on operational excellence because our parent company is Blue Cross Blue Shield of South Carolina. Our claims processing unit, our customer service units, we're held to the same standards as we are on our major med business. And so what that means is all of our customer service advocates, they go through the same training that we do on our major med side. All of our claims process adjusters, they go through the same training. All of our QC standards are the same as they are on our major med plans. And so when a member utilizes a network provider, which we talked about a little bit earlier, about 99% of employees utilize a in-network provider. What happens at that point is the provider will file the claim electronically to PAI, just like they do on a comprehensive plan. The reimbursement, if there's any balance that's owed after what PAI is going to reimburse the provider, then they will take that payment from the member up front. If our reimbursement amount is higher than what the doctor's office visit costs, which happens periodically, PAI will actually pay the provider their charges. We will reimburse the member the difference. And so that member may actually realize a little bit of money on top of it. We don't promote that, and that's not what the intent of the benefit is, but it definitely happens that way. So we have a pharmacy benefit that's included in our limited benefit offering. And if they go to an in-network pharmacy, which we use the Optum Network Pharmacy, which is a large PBM that we utilize, again, that claim will be auto-adjudicated, submitted to PAI, doesn't have to have anything done at the member level. So we try our best to make it as seamless with as limited disruption as we have at the member level.
Well, and I want to go back to something. You talked about a support team earlier. Is that available just at the employer level, HR, CFO, or do you offer any member support services to help understand benefits?
Yeah, so PAI has about 60 customer service reps. We take about 2,000 calls a day into our call center. And so that is 99.9% member calls. So when a member gets an ID card, they have the PAI 800 number on that ID card. And if they have any questions, they can call into our call center. We also offer what you referred to as kind of group support. So we have a marketing team that's made up of about 10 or 12 individuals, and their job is to handle the group questions. So whether it's an HR, a CFO, a CEO type questions, they know to reach out to PAI marketing service rep, but at a member level, everything comes through our call center.
You've been doing this for quite a while. You all have perfected the process. But I know you all also don't sit still. So are there any upcoming enhancements that PAI has for the limited benefits offerings that you could share with us publicly?
Sure. Yeah, we're really excited about some things. So you're right. We have been doing it for a while, but it's a changing market. It has changed. Pre-healthcare reform, we had one product offering. Post-healthcare reform, we have other product offerings. And to be honest with you, our sole mission is to bring value to our employees. These are employees that are sometimes lower paid employees, lower wage employees. And the last thing we want is for them to not be getting their perceived value of their product. So everything that we do is to improve the member experience, both from a service standpoint, and then what we refer to as improved member utilization. And that really has two fronts. So member utilization at a group level is how many people are actually enrolling in my plans. Because think about it, most times these are 100% voluntary products. The employer does not charge or contribute anything to these products. They offer it to their employees. And so we really want to make sure it's a good, educated decision that the employee chooses. And so we're looking at a couple improvements. One is a pharmacy enhancement. That is just something that as pharmacy costs continue to go up and up and up, we're doing everything we can to push our volume through to the pharmacy team to use our purchasing power to help these individuals. That's the first thing. The other thing that we're working on is what I would call is just overall plan utilization. So how do we continue to help these members realize what benefits they have, what have they used and purchased from their own purchase, their own paycheck, spent their hard-earned money. So how do we educate them? We try to educate them at the time of onboarding, which is when they enroll in the product, but we're working on constantly communicating. We're working on our electronic capabilities with their permission. We're working on ability to send them texts, remind them that they have these benefits. And we're also working on more virtual offerings because as our population continues to get younger, or I continue to get older, the younger people are much more comfortable doing things virtually and doing things with their cell phones and all that stuff. And so we're trying to meet them where they are, which is not always easy because we have some regulation and we have some oversight and we want to make sure we're doing things right. But at the end of the day, we're just trying to meet the members where they are.
And I want to tie a bow on the financial component because you mentioned a couple of times that these are voluntary products that are being offered. So if I'm a benefits leader, a consultant, an employer listening, I can assume that means that there is minimal cost, no cost to the employer.
No cost to the employer. They are 100% voluntary. We do have a very small percentage of employers who make a decision to make an employer contribution because they see enough value in the plans and they want to help retain and recruit new employees. But less than 5% of our employer groups contribute. The other thing that we've worked very hard is because we know HR benefits leaders are stretched thin and they have to handle major med plans and high turnover. It's hard. It's tricky. You got a lot of people coming and going. And so everything we do administratively is to take that burden off of the HR leader, put it onto PAI, let the employer reap the benefits of retaining and recruiting good employees and letting PAI pick up the administrative burden of that for them.
Well, you all, like I said, you're exceptional at what you do. And the employers that have chosen to partner with you are very fortunate because, yes, the war for talent is real and it is tough. So PJ, thank you so much for joining us today and for sharing the PAI story, giving us a little bit of a sneak peek into what's to come. And thank you most of all for being a partner of the Granite List.
My pleasure. Thank you for having me.
You bet. So thank you to our audience as well for tuning in to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.